Diabetes and Ramadan video. Hello, my name is Dr. Qamar. I am a GP at Hall Green Health. Ramadan Mubarak to all of you celebrating this holy month of fasting. I am the diabetes lead for the practice and for Birmingham and Solihull CCG, and this video is on fasting and diabetes. Although most people with diabetes are exempt from fasting during Ramadan, some of you will be considering whether or not to fast this year. And my aim is to ensure that you are fully aware of the facts before making an informed decision regarding this, as well as offering you some practical tips and advice if you do decide to observe the fasts. Who can fast? If you have well-controlled type 2 diabetes and are not on any medications, there is no reason why you cannot fast as normal this year. In fact, intermittent fasting has been shown to have many health benefits, including lowering blood sugar levels and even remission from diabetes. If you are taking oral medications which do not directly lower your blood sugar levels, such as metformin, you may also be able to fast during Ramadan. However, do speak to your GP or healthcare professional beforehand, as you may need to adjust the timing and dose of your medications. Who should not fast? If you have type 1 diabetes, are taking insulin or high doses of glucose lowering medications such as gliclazide, if you have poorly controlled diabetes, including regular episodes of hypos or reduced awareness of hypos, you should not fast. If you do decide to fast and you fall into this category, please be aware that you are putting yourself at significant risk. I would strongly urge you to speak to your GP or healthcare professional before you commit to this decision. General measures whilst fasting. For people with diabetes, deciding to fast during Ramadan is a personal choice. If you do decide to fast, you should make an appointment with your doctor 1 to 2 months before Ramadan to discuss how best to manage your diabetes during this period. The first general tip is to remain well hydrated and drink plenty of fluid during the period between opening your fast and closing your fast. This is particularly important during the summer months, where the days are longer and the weather is warmer, so the risk of dehydration is much higher. Symptoms of dehydration are dry mouth, muscle cramps, nausea and vomiting, and palpitations. Secondly, try to eat a meal before the break of dawn, which includes a high fiber source of starchy carbohydrates, such as porridge or muesli with some nuts or seeds. When you break the fast, you should also try to eat a well-balanced meal of modest portion size, again including a high fiber content, such as basmati rice with dal or beans, along with plenty of vegetables. Try to avoid eating sweet or fatty foods, such as too many dates and samosas or spring rolls. If you are planning to go to the mosque in the evening, you may find it beneficial to have 2 smaller sized meals before and after your prayers so that you do not feel too bloated or lethargic. If you are taking medications for your diabetes, you must be aware to speak to your doctor before you decide to fast, as the dose and timing of these medications may need to be adjusted. You should also check your sugar levels more frequently whilst you are fasting. And if your glucose level is less than 4, or if you're feeling unwell, then you should break your fast immediately and seek medical advice. That's it from me in this video.